Hello, everybody. Hello and welcome. It is so good to see so many familiar faces. My name is Rachel. For those of you that don't know me, I am the chair of the patient arm of Coffi, who are a collaboration of scientists researching fatigue following infection. And I'm speaking also from lived experience of having recovered myself from long COVID. And the aim really of this seminar is to make the science accessible and to make it accessible in a way that helps people recover. And I have to say, it's amazing to be live. We've done a few videos that we've put onto our YouTube channel called Fatigue Science Talks, where we've just had the panel, but there is something really powerful about bringing a mix of people together, some researchers, some clinicians, some patients and therapists and coaches, and also people that have either recovered or helped other people recover. And today we will explore the sickness response from a psychoneuroimmune, got to get that right, perspective. And we'll be looking at how the brain and the immune system interact during an infection and why these signals may persist. And more importantly, how knowing about these mechanisms may lead to recovery. And with that, I'm delighted to introduce our panel. And I'm going to start with Amy. Amy, would you like to introduce yourself?
Sure. Hi, thank you so much, Rachel and Coffee, for inviting me to be part of this. My name's Amy Engkjer, and I had long COVID and I had a full recovery. And since my full recovery, I have started a nonprofit called Positively COVID that helps people recover with the resources that I've gathered. And I offer those on the website. Thank you.
Thank you. Thank you, Amy. And I'm always offering Positively COVID out. I think it's brilliant, a mixture of interviews and stories, but also tools that helped you recover. So really excited to be part of the panel with you today. We've got Rebecca. I'm not even sure if Rebecca's on the same page.
We have to scroll because it's a nice, robust group. So great to be here. Love seeing some familiar faces, Mabel, Jackie, and others. I'm a mind body coach, and I came to this field through a very long journey with ME/CFS, and now help other people recover from conditions like long COVID and post-viral syndromes and the category of symptoms we call neuroplastic.
Thank you, Rebecca. And I have to say, Rebecca, I'm on a lot of patient groups and I am constantly hearing your name as someone that's recommended. And I
Oh,
have to say, I have never heard anything but positive
oh,
from I've literally never heard anything that is,
oh,
you know,
that's an honor. When
talking
you've been through it, you really care and you really get it. Thank you.
exactly. And talking to Mabel, who's part of Coffi, and she's then designed her own online program in Dutch, but using some of the things that she learned from your program. So thank you. I'm really excited. And we've got Mats Lekander.
Yeah, hi. Thanks so much for inviting me for this webinar. I am a researcher at Stockholm University and Karolinska Institutet in Sweden.
Amazing. And Mats, I read your book, which is called The Inflamed Feeling, and I've literally been recommending it to anyone that will listen to me.
Oh,
I think it's brilliant and lots of things that then I was able to reflect in terms of my own journey that made a lot of sense. So really excited to hear about your research. But I do want to start, I think, from the patient perspective and to hear from both Amy and Rebecca in terms of how they kind of came into this world. And what happened in terms of particularly the sort of illness and onset. Amy, do you want to tell us a little bit about what happened to you and how bad was it?
Oh, it was bad. So I was living a full, healthy, productive, active life. In 2020, I got COVID right in the height of the pandemic. And the initial virus was really intense, really sick. I mean, for a couple weeks, it was the sickest I have ever been. I had more neurological symptoms than anything. The palms of my hands were numb. I had shooting pains in my head and throughout my body. I was sensitive to sound and to touch. The fatigue was just unbelievable. Taking a shower I couldn't even get through taking a shower without having to sit down in the bathtub. And then it didn't go away. I had a friend that got COVID the same day I did, and 2 weeks later she was up and feeling awesome. And it just got worse for me. And the noise from outside and in my own head of, oh, this is permanent and you should be doing this, just I believe just made it that much worse. And we were trying everything. I say weeks. My husband was desperately trying to help me and was so worried. But it went on and on and on for months and months. And yeah, I think that it was this sort of perpetual noise that was in my head that just made it so much worse, and trying everything and having there being this conflicting information of some doctors saying, oh, you'll be fine in a week, and then a week would go by and I wouldn't be fine, and then hearing online people saying, oh no, this is permanent, and the depression and the anxiety that set in, and suicidal thoughts because I thought, this is my life, I've lost it. So that was the intensity of my illness.
Yeah, and I was reading on Positively COVID because your husband had actually put some comments about how ill you were, and he said, my wife of 16 years, I didn't know if I'd get her back, and he was so full of fear as well. Amy, what did you think it was? What did you think was happening at the time, and did you try anything to
Well, I didn't know. And I think that was the scariest part, was not understanding why this was going on for me and then getting all this different information from people. I tried everything, thousands of dollars worth of treatments, injections, supplements, anything that I could do. Ivermectin. I tried it all. And I actually feel as though it would exacerbate. I would get almost worse the more I tried and the harder I tried to figure it out. So yeah, we tried everything.
Yeah, and it has a happy ending, doesn't it? Because you've already told us that you were covered.
It did. Yeah.
Thank you, Amy, for sharing that and kind of going back there, which I know can be really hard to do. And Rebecca, what happened to you?
Well, I can relate to a lot of what Amy shared. For me, I was a busy, active journalist traveling the world, and I went through a really traumatic event. It was a sexual assault. And after that, I caught a virus and my system crashed. It was sort of the quintessential descent into not really being able to do much of anything. I actually had to crawl initially from the bedroom to the bathroom. I couldn't remember the name of my best friend. There was such severe cognitive dysfunction, exhaustion, and insomnia. And actually, I think that was the worst thing because I was so exhausted, but I couldn't sleep. And I had previously been a great sleeper. So all the sensitivities Amy described, light, sounds, anything would stimulate me. A lot of digestive issues, bloating, constipation, so many different symptoms. And of course, it was terrifying because I was someone previously who had been quite healthy. So my mom had to drive me around to many different doctors, and they diagnosed me with ME/CFS, chronic fatigue syndrome. And over what stretched into over 13 years, I was diagnosed with more things than I could possibly name here. But I think relevant for this discussion is Epstein-Barr virus reactivation. That was something a neurologist really honed in on, and we did antiviral treatments that were IV, that were intravenous, all the supplements, diets. I ate green vegetables and just protein for 3 years, which made it a lot worse. There was just, alternative medicine, CFS specialists, and it really never got better. I would say over the stretch of 13 years, it would ebb and flow. There were periods I could walk around the block a little bit, but I had to leave my career, and the ability to exercise or socialize or things like that were not really available to me. Um, Mine does have a happy ending too, but I'll save that for later.
And
Yeah.
Rebecca, I can't even imagine, 15 years of your life and having to, leave your job and,
Mm.
all these different scary diagnoses. Did you try anything? So, what did you try? You said antivirals. What did you believe?
Oh my goodness. Yeah, that was something that I took, the antiviral medications, just because a doctor told me it was this Epstein-Barr reactivation. Interestingly, the titers went down, and apparently the antibodies went down, but I didn't feel better. I landed back in bed for a long time. I tried, yeah, everything from acupuncture and energy work to lots of different supplements, hyperbaric oxygen. I mean, just so many different things that doctors told me. And I remember pretty early on, it was 3 months, and one physician said to me, "Well, now it's chronic, so there's no rush." And I was just devastated, because I was trying to hold on to my job, and I was on short-term disability. And another doctor then did say, "You will have to live with this for life. There is absolutely no cure." And when I think back, I got a lot worse after that. And I really expected that was going to happen. Oh, I should also say I was diagnosed with chronic Lyme. And so I did try antibiotics, which didn't help either.
Thank you, Rebecca. And I
Mm.
can see Matt's kind of nodding and making notes. So I would love to come to Matt's and ask you, Matt's, what do you know and what do you think is going on with these post-viral conditions?
Well, a main hypothesis is that you have like what is basically a healthy sickness response, but that may get stuck in some way. So if it doesn't wane off, it seems to contribute to fatigue and depression. It's a little bit hard to actually capture in research, but we do a lot of studies to try to link the acute response to the more longer term problems that you can have, because what is healthy in the short term may actually be a great contributor to ill health and having a lot of dysfunctions and suffering in the long term. But we know, for example, when people have been treated before for hepatitis, with molecules that are released by the immune system when there is a viral challenge or bacterial challenge or something, really many of these treated within weeks develop major depression or severe fatigue. So we know it can turn into longer term during certain conditions. So this is one hypothesis that we work with. So I tell you a little bit about this research and the sickness response. And you can actually, Rachel, if I talk too long, you can just make me up. So the first thing, is there immune to brain communication, and why should there be immune to brain communication? Because we have a barrier, a blood-brain barrier, that would hinder a lot of these communication pathways. So if you have a white blood cell in the periphery, somewhere in the body, in the bloodstream or in the stomach or wherever, would it be necessary for that white blood cell to communicate with the brain and why? So I'll talk a little bit about what we do to understand that. So we know that when we have exposure to virus or bacteria or other things happening in the body, we have signaling to the brain. And these are inflammatory mediators with a lot of names. And they can be released then into the bloodstream and then actually communicate with the tissue side of the brain or via nerves. So there is a communication pathway that we know more or less exactly how this works. So up to the brain, the signal goes. And for example, the green dots here are the inflammatory mediators, and then you can have bacteria or virus or something else triggering the white blood cell. So this could be something like bacteria, the red little things I did in my PowerPoint presentation there. But it could definitely also be like Epstein-Barr virus or COVID-19 or something else triggering more or less the same sickness response. It's not exactly the same, but generally we have this response when you have some perturbation like that in the body. However, it's so I think I call them, I know this is not like an official term, but I call them sickness signals because it's interpreted by the brain as sickness signals, something in the body telling you that you are sick and that you should change behavior, do things differently. And that's why when the subjective part really kicks in, and it's quite fast actually, this response. I think it's also important to note that this can happen in response to other stimuli that are more perceived from the outside, like outside threat. So a classic stress response actually involves an immune response. So the acute response, when you have acute stress, a threat of some kind, this also actually primes a little bit the immune cells to respond more and also to start release some of these mediators into the bloodstream, changing actually the physiological condition of the body. So I took away some of the molecules here because we don't really know that this is so strong that it actually impacts brain and behavior, but it's very clear in the periphery, very clear also from the stress response. So it's basically that the immune system, it's involved in response to different kind of threats. That's good, like from an evolutionary standpoint. So why is this? Why do we have these functions? Why did they evolve? Because we obviously inherited these systems and responses from our forefathers, so it was good for them at least. Maybe not now, or not as good. So one thing is that the brain, as a master regulator, of course, is involved in actually regulating immune function. And here it can actually like in the stress response, upregulate the immune function, but it can also downregulate and actually dysregulate immune function. I showed it here as downregulation because if you have stronger stress response, it's important to dampen this dangerous response using also the brain machinery. But if you have chronic stress exposure, it seems that you can actually dysregulate the immune cells. So you have this low-grade inflammation with some of these green dots being released into the bloodstream, and that may not be as good in the long term. So immune regulation is one reason we have brain-body, like brain-immune interaction. And another one is then the sickness response, the main topic here. And you have more of the green dots, the inflammatory mediators. Certain areas of the brain are really responsive to these changes in the body. And you have the subjective and objective changes, both in brain activity and in behavioral measures. And what comes in here is the classic, like the behaviors or the feelings, the cognitions that you are fatigued, that you have a depressed mood, more or less, some anxiety, you don't want to move, you're less inclined to social interaction. You actually get a little picky. You can interact with people that you really trust or can provide care to you or warmth, but otherwise you don't want to go to cocktail parties, if we summarize what we know. You have increased pain sensitivity and some spontaneous pain also, and you have this switch towards bodily attention. So that seems to be part of it, that you want to care about your body. So the challenge in the body signals to the brain and you turn inwards. So you actually focus more on bodily symptoms, which is good in the short term, right? And why is this good? Here is the answer. The immune system needs energy. It consumes a lot of energy, and especially when you have a fever response, which is part of this response when you have an infection. I think it's important to remember again that it's not only happening during real infection, it's happening during many conditions. When you have the inflammatory activation, you have a signal to the brain, and then you have some of the sickness responses. So what we can do then is that if you have the sickness response, again pictured like this, you have bacteria that enter the body and they are detected by receptors on white blood cells, same as I showed before, but just in another way. You have activation of the cells, you have release of these inflammatory mediators, you have a signaling to the brain, and within an hour or so, you have a sickness response mediated by centers in the brain. These centers are central for regulating how active you want to be, where you focus attention and your emotions. So you can actually have a trick here. You can take part of the bacteria, not the full bacterium, because you don't want to make people infected. So what we do and others do is to understand the sickness response and how the brain changes and who is sensitive, etc., by using a small part of the bacterium and then inject that one. Then there is no infection because there is no pathogen. It's not full bacteria, live bacteria. It's only part of it. But the immune system responds having this signaling. It can look like this. So this is me. This is my arm. I'm not the doctor, I tell you. I'm the patient here. I pretend to be patient, or at least I get the sickness response for 4 or 5 hours when this doctor injects this part of the bacteria into my bloodstream. It takes 1 hour and then I feel, oh no, something's wrong. And then I have this response, the sickness response with fatigue and depressed mood, etc. So then we can understand what's happening in the brain, what parts of the brain are involved, what cognitive changes do we have. You feel fatigued, but in what way? Is it like more mental or is it more physical fatigue? What kind of negative mood? Who is actually affected? Because we don't really know why some people are so insensitive to these signals and some other people are more sensitive. So these are areas that we really try to understand by investigating brain responses, behavioral predictors, etc., etc. Perceived threat. And lastly, what we are trying to do, and many of us in this field, it's to understand what's happening when you have this adaptive response, what actually made our forefathers to live through infections and pass the genes over to, well, people like myself, for example. And when and for whom would it turn into maladaptiveness so that you actually are not helped? Because if you have a long-term sickness, why should you have reduced motivation to do physical exercise or feel pain or social disconnect? it wouldn't make sense in the long run, but why can it get stuck as we think it is? And that's actually then the switch from short term to long term. So that's where we are, many of us in this field, understanding this gap that we actually have here. So thank you so much, Rich.
Thank you, Mats. There's no way that I would stop you because it's all really fascinating.
Thank you.
And I was trying to make notes and then I stopped, but I'm very excited to watch the recording for all the things that I probably missed the first time. But I just did make a couple of points, and then I want to find out from Amy and Rebecca in terms of what stood out for them and how might it relate to their journey. And the first thing I wrote down was that the symptoms are not the virus, but it's the body's response to a threat that creates the feelings and the motivations to behave differently to protect us. And that is huge. And Mats, despite, I mean, that's textbook biology, right? We know this, and yet despite the fact that I have a degree in biochemistry, I completely forgot that. Well, it was quite a long time ago, but in the pandemic, I believed that COVID was the thing that was giving me these strange symptoms, and I would log on to non-COVID groups, and they would talk about COVID being the gift that kept on giving, and I somehow forgot that it wasn't actually the virus. But you know, what I also wrote down was that stress and expectations and regulation can affect the immune response too. I mean, I love the fact that you're actually injecting yourself to research these motivations. I know we're going to find that out later. But you said, you know, you didn't know some people are more sensitive than others. I've always talked about having anxiety when I'm ill. I said to my partner last year, we both got sick with the same bug, and I said, I feel really anxious. He had no idea what I was talking about. He had the same illness, it affected our whole house, and yet our responses were so different. He basically took some Lemsip, pulled back a little bit, mostly got on with things, didn't really seem bothered. I was like tearful. I was worried about work. I was worried about when I'd get better. I started Googling. He got better in half the time. It took me twice as long. And so, you know, I think that's just really interesting that we all kind of experience this sickness response differently. And maybe that gives us some indication in terms of what might be going on. Amy, yeah, what sort of stood out for you, and you know, how does it sort of relate to your journey and realizations?
Well, first of all, Mats, thank you so much for that. It was so wonderful to hear you explain that, and it gave me such a clearer picture of what I experienced. It made sense. Okay, this acute virus that I got, and I had this sickness response, but then that went away. But the fear, the worry about what was, you know, what people were saying and my thoughts that were coming up, that then perpetuated the sickness response. And it's interesting to go back and to look back on that now and see that that's what happened. Not that it was my fault, but that I contributed what I was hearing or what I was thinking. But you also said something I found really interesting, that you said that some people maybe are a little less, they're maybe more insensitive to some of these signals. And I think I've said to Rachel in the past, you know, I've always been considered a highly sensitive person, which can be a superpower if you embrace it. But I've also been extremely highly suggestible, I guess. You know, if somebody would talk about insomnia, boy, I wouldn't sleep that night. And I also had, I'd say, historically operated from the sort of watchtower place, scanning for danger, probably from experiences in childhood. So if that then set me up for this, maybe whether it was past experiences or the current pandemic that we were in, where the entire globe was under, you know, unrest, that helps explain why I stayed in this pattern. But it was also I think really, really good news, because then once I realized that I could quiet that noise by not getting on social media or not following the thoughts and the symptoms that arose, that the alarm bells would quiet and then safety would resume and that sickness response quieted and I would feel better. And there were days that I'm like, okay, I'm fine. And then I started to notice as soon as I got, oh, I'm going to look something up, that everything came back. So it's just amazing. And I loved the hearing the scientific, what was happening inside me. And it all makes it, you helped it make so much more sense.
And
Yeah.
can I add?
Yeah, absolutely.
Because it's great that you say that it's not your fault, and it's obviously not something like you have a certain thought and you do a certain behavior for some reasons and then this will happen. This is like most of this is just automatic, and it's healthy bodily responses. Basically, they are there to protect you, but they can be dysregulated. And one thing that you say is that the worry and the fear would perpetuate this. And this is a good hypothesis, actually, because if you're more fearful and you maybe worry about this at night or before bedtime, this could make you feel worse and more stressed, and that can be, we don't know actually, but it can be one pathway to actually not turning down this signal, the sickness signal, so to speak, from the body, and how much attention you give to it. And that's also automatic. You should attend to the body when it's signaling to you in this way, but it should also be like regulated you should have in most cases you should just have your life, and then you should consider the bodily condition when it's needed, but we can all do it too much. But and lastly, a comment on what you said is that we don't really know who is sensitive or not. Sensitive here is basically good because we inherited this from through our genes, but to really predict who would have like a cytokine storm, that was happening during the COVID-19 when it was as it worst, at least, and who would have the strongest brain response and the behavior response. That's really a question that we are trying to understand more.
Yeah, thank you.
Yeah, thank you, Mats. I know in your book you talk about interoception, and some people I think are more sensitive to bodily sensations than others. Rebecca, what stood out for you?
Yeah, Mats, to me, knowledge brings safety. So much of what you shared just helps me better cognitively explain my experience. And a few things stood out. One is just you describing that the sickness response can be initiated from a virus or a threat. And when I think of my history and feeling extremely threatened. I literally thought my life was at risk when I was assaulted, and didn't tell anyone and kind of held that in. And then I got a virus shortly after that. And so there was already a very high level of threat in my system that I wasn't able to process. I had no reference for this. And then, of course, going to all these well-meaning practitioners who said, you will not recover from this. You're 33 years old and you will live with this the rest of your life, was utterly terrifying and totally distressing to me. That was a major threat, that the diagnoses, and they kept mounting, but also the prognosis, right? So there was lots of different threats going on. And then, of course, the symptoms themselves and losing one's job and ability to function. And I think listening to you, it gives me even more compassion for myself and everyone that goes through this, right? Because we can tend to blame ourselves. But first of all, you're painting this case, it's our biology, and it's trying to help us. And that was another piece that really stood out is, the brain is trying to increase your chance of recovery. And so that's why it is creating the low mood, the low social drive, low energy. And I thought it was really interesting too when you said there is some like selectivity, because I remember I would have a little bit of energy for people who were caring for me. I mean, like my parents had to bring groceries to me, and one dear friend. First of all, people who were a little calming, but also just people that I knew I literally needed for my survival.
Wow, thank
Mhm.
you. Oh,
Mhm.
so many good points. And I think you're right, Rebecca. Just having an explanation actually is so helpful. I wish
I
Yes.
loved. Oh,
explanation. Matt.
sorry, Rachel. Sorry for interrupting. I just loved your the sentence. Knowledge brings safety. I think you said that's really wonderful for me to hear.
And Matt, what I find really interesting is you're talking about the acute response, the acute sickness response, but then the chronic, and then there's this bit in the middle that we don't absolutely know in terms of the mechanics of what
Mm,
is happening.
mm, mm.
And you're injecting yourself with bacterial or part of the bacteria in order to be able to test the sickness response. I mean, what are you aiming to do? You can tell us more about this research.
It's understanding how the brain interprets this, and I mean that in with biological outcomes, looking on the signal, the inflammation, the levels of inflammatory mediators released. We look on what parts of the brain and how much are they up or down regulated, and what could predict a stronger sickness response or actually a stronger response in anxiety, because as we talked about it, we at least think that this is like a driver of not shutting, because the system is really there to be activated, should be a strong response, but then it should be downregulated. And anxiety may be one of these factors that actually makes you want to act too much on the appraisal of the bodily condition. As it's not like I have pain because I had physical exercise. It's like I have pain because I have a mortal disease or something really threatening. So the interpretation and the anxiety and the drive to really act and focus on the symptoms, these are factors that we that we really try to investigate among other things. So I think, but one observation that I had then when I did this the first time, the injection, was that it was such a difference for me because I knew, I mean, I worked for years to have this model established. And then I almost liked it. I felt like I was sick in a interesting way and a good day at job. And at 5, I will have a painkiller and go home. And then it really struck me the difference that when you don't know what it is, and of course that makes you fearful and anxious.
But that's right, isn't it? When you know it's only going to last for 5 hours, the difference.
Yeah, and I think it's also similar to when you have a vaccine shot, because if you're afraid of the side effects, that will actually be a factor that will make you hesitant for taking another vaccine. So we know that that's a factor, but the way that you respond when you have the sickness response, as you may have from a vaccine shot, that's sign of a healthy immune response, similar to a healthy stress response when you, whatever, give a talk or do something that is a little scary, but still part of life. So that's the basis, and then these responses can be dysregulated and not turned off or too sensitive.
Thank you very much. And what do we know anything in terms of what predicts who might get these illnesses? Is there any research in terms?
I will make you quite disappointed, and I do. I need to tell you that I don't only make people sick, I only also try to make people healthy. And so we do cognitive behavioral therapy treatments and similar techniques for now it's mainly actually on severe long-standing fatigue. So from different conditions, we try to have treatments that will hopefully make them better while measuring objective and subjective outcomes of different kinds, like how much you move, body temperature, but also depressed mood, fatigue, etc. So we do that as well. So that being said, looking now back to this basic research when we make healthy people sick with the intention to make sick people healthy, I must say that. So with this model, we try to look on brain centers that respond a lot to the immune signal. And there, I didn't talk about it, but one center that was actually shown in one of my pictures is especially interested in bodily changes. So it's responding to that. And especially in the back of this part of the brain, like it's on the inside here somewhere. And when the signal travels forward, more and more of the interpretation as subjectivity comes in, like, am I sick, am I old, or did I just have physical exercise or a vaccine shot? More of these thoughts and memories and feelings come into play. And then the brain can down or upregulate the signal depending on context and interpretation. So these brain-centered explanations is part of what we do.
Wow.
We also look on physical activity and how much you have exercised before you have this activation. We look on sleep. And we do look on caregiver behaviors, and we look on prediction, that is like expectations of how sick you will be. So there we're doing a large study right now, trying to follow up on our earlier findings to see what we actually had indications of, that some kind of expectation was actually a predictor of getting more anxious and more sick.
I think we need to do a 2-hour seminar next time. I really do. Mats, I remember you saying that one of the predictors when people have acute illness is how much people move. And I've heard that before with Maria Pedersen's research as well, where they discovered it in adolescents with acute EBV, that the more that they moved, the less chance they had of experiencing fatigue post 6 months. So that's really interesting, because we're told to rest and to go to bed when we're sick, but maybe it's that balance. I do want to, Rebecca, you've been nodding furiously there. I do want to go to Rebecca and, well, I want to know how she recovered, but also whether there's anything that stands out, Rebecca, for you.
Yes. Yes. And I was nodding. I'm so glad you brought up the pacing and the physical activity, because I was told that if I did more activity than my energy envelope, I would damage myself. I would actually damage my mitochondria. So there was so much fear of movement, and that was perceived as another threat. And so I think in terms of the turning points and what I'm really relating to what Matt shared is just on my own volition, I stopped focusing on the symptoms or a cure, because I mean, 13 years, several $100,000. It was clearly fruitless. And I really just started gentle yoga and meditation and kind of looking into nature as much as I could, writing poetry. And I will say that there was a year of that where I felt mentally and emotionally much better, not so much physically better. And it was from that place, I think, of receptivity that I met online through an online writing course, the first person I had ever heard who recovered from ME/CFS. Because, this was many years ago. There were not programs and things out there. And she told me about the work of Howard Schubiner and John Sarno, and that this was caused by my brain and nervous system. And I had a light bulb moment, and it was the only thing that made sense. And I actually felt she really cared about me and understood me. And I recognized my story in hers. And I got up and ran around the block. I said, I'm not sick. I'm not broken. I'm essentially traumatized. And I felt so much safety. Now, the symptoms came back. I did not have a spontaneous recovery, but from that point onward, my interpretation of the symptoms, the meaning I gave them really changed. And for me, I really needed to hear this too from a doctor and a scientist, which was Howard Schubiner. And his work helped me so much, really. Again, it was like that knowledge is safety, Mats. Really look at the symptoms in a new way instead of looking at them as an irreversible disease process, as more of a state in my brain and nervous system, and something that I had some agency to affect by the messages I was sending. So just more activity without reacting to symptoms I actually started seeing that as a positive meaning, as a positive outcome, even when I would get symptoms. Meditations, other things that would just kind of calm down my nervous system were all really helpful.
Amazing. Rebecca, and how long have you been recovered?
It's been about 8 years now, 7, 8 years. Yeah. And it's so incredible. Like the first time you go on a hike, the first time you dance again, the first time you go on a trip. And I would say it was not quick for me. It actually took several years to, use this graded exposure to do more and more activity and get symptoms and not react with the same level of fear.
Wow. Thank you so much, Rebecca. Amy. Amy,
Oh my gosh. Well,
journey similar or?
Oh, so many similar things and so many things that both Rebecca and Matt said that Rebecca, you talking about knowledge is safety, and Matt's talking about how the brain interprets this. And I remember noticing with my own homespun versions of, meditation and calming my system, how I would feel better, but I still wanted to get an answer. And I remember being sort of on the verge of feeling like, okay, I'm recovering. But I Googled doctor with long COVID because I wanted to talk or hear from a doctor that had gone through this, because my doctors were like, they couldn't quite grasp all of these symptoms I was going through. And I ran across Dr. Paul Garner, and that changed everything for me. I mean, he explained what was happening and that there wasn't physical damage, that I was in this looping system of fight or flight. And it was within a week. I was like, I'm done. I get it. And I understood. So that knowledge and how the brain then interpreted, okay, I'm actually not sick. I'm okay. And then I attempted to move more and socialize more, which then I'm gathering turned down that sickness response. And I just think that additional information, we have the science on one hand that we need to get that information, but then on the other hand, there's this sort of non-conceptual, wordless, immeasurable sense that when we feel peace, when we're communing with nature and with loved ones and meditating, that we just feel that inner wisdom that we know we're safe and that we have this innate well-being, that when we can connect with that and get out of our heads a little bit, that then we start to connect with that a little bit more, less with trying to figure it out. And so, yes, everything coming full circle. And that was my turning point. Thank you, Paul. And I've never looked back. Yeah.
I remember meeting you towards the end of that journey, and I was like, just go on a hike. And you were like, I'm going to go on a hike.
I did. And I went on a hike and I took a picture of myself on top of a mountain, and I was like, I did it. Yep. And then the evidence builds and the brain calms, and yeah.
That's amazing. And we've got an audience, so I would love to throw it out to our audience as to whether anybody has any questions. And Paul must have known that was happening because his hand's gone up straight away. But we've got time for a few questions. So if you want to use the virtual hands, there you go. We've got Fiona, Paul, and then Claire as well. Paul.
I wanted to comment that I am embarrassed about my colleagues and other medics being so ignorant of these conditions. And I loved the presentation, Mats. I have just got a letter from 67 doctors. It was a petition, actually, saying long COVID is real. because of all the biomedical changes in the tissues. Stop saying it's something to do with the brain. What I'd like you to do, Mats, is just to comment on you talked about the cytokines in detecting virus and so on, and stressful events and feeding up to the brain. And then you talked about a dysregulation of the stress response. But it just would help just to have a little bit more detail about how that might then reflect in tissue changes in the body, or some of the symptoms and biomedical changes that people report in post-COVID and ME/CFS, because those small changes in scientific biomedical papers are what are being thrown at us to prove that this is a biomedical condition.
Thank you. And I'm kind of embarrassed by hearing professionals thinking that the brain is not biomedical. What is that? What kind of thinking is that? It's of course it is. And when I speak about these things, I'm really looking on both classic biomedical outcomes and more psychological. But sometimes when I talk about psych or neuro or something, I can get letters that say, well, don't you know that this is a biological disease? And well, of course it's biological. Of course it is. So I think it's a lot to do with language and the models and the metaphors that are often not well put, I think, or chosen. But anyways, so what we think is happening in the acute threat or the acute stress response, the classic one when we in the outer world encounter danger of some kind, then you have an increased risk of danger of injury or infection, and you will have a wound, etc., where you need the immune system. So it's very natural that you upregulate immunity, and you have more white blood cells into the bloodstream. So they are like soldiers now, not only in the barracks but also in the streets, ready to go over to the tissue side, where they eventually will be needed if you're actually hunted down or whatever is threatening you. But there are many reasons to have this activation. So that's one part. You can really measure that. It's really clear. Then when you have a really strong stress response, you can kind of disturb the regulatory pattern. If it's really, really strong, like when you have a cortisone, or you have like a drug that will use stress hormones, then you will dampen, as everybody knows, inflammation. But the basic thing is upregulation. Then when you have like more long-term stress exposure, you can disrupt some of the immune functions, so they work less well, like how many cells that divide, or how good they are at attacking tumor cells or other classic measures. However, what I think is important here is that you can dysregulate this inflammatory balance. So you can have this low-grade inflammation, and that is measurable in blood and also in tissue, and in how responsive the organism is, often like an animal. Not all, it's also humans. What's that something like what you were interested in, Paul, or?
Yeah, Mats, I often talk about the fact when I had COVID, my toes went purple, and I thought it was COVID toes because I saw it in the newspaper. But then after I recovered, I had a really stressful event and the same toes came back, but the context was different. But it was obviously the soldiers were coming out. And we've got Fiona. Fiona.
Hello. Hello. It's lovely to see so many familiar faces, and this has been really fascinating this evening. And Mats, it's really lovely to meet you. I'm always telling people to read your book. I think it's brilliant, and it's I recovered from actually 25 years of pain, but also 14 years of ME/CFS, and I've been well for 7.5 years now. I'm very lucky, and I'm so curious about, sometimes people are doing amazing work in kind of different corners of the globe, and I'm just feel like I'm part of this growing bottom-up recovery movement where there's so many people recovering from all sorts of symptoms, which is just the most exciting thing ever. I think we're so lucky to kind of be involved in this sort of area of work. It's just so, so exciting. But I'm just really curious about, I suppose, are you aware of this kind of growing group of people that are getting better? And is it feeding into any of the research that's happening at the moment?
I hope it is, because I feel, well, from my corner of the world and also the research I do, this experimental part, what I really love is to meet clinicians and to meet people who were or are patients, because that will actually tell me what is important and what is more of academic interest. So that really grounds me in that way. So I think it does. I think, for example, the techniques that are used in some more classic somatic or so-called somatic disorders, where you try to reinterpret bodily signals and how you expose yourself to bodily signals. Like, for example, if you have some cardiac symptoms, for example, you can get a strong fear response by just having something from the body, or even having a little pulse and an increased heart rate. So there are many exposure methods that really work for patients to calm down how much they respond to the signaling from the body, so to speak. So we try to connect that now to, these behavioral techniques that are used in therapy, not only in experimental research. So we try to connect them to our experimental models to see how we can help in these control models, how to respond differently to bodily signals, but also if we can bring our experimental parts over to the clinic and to the patients. So we have a lot of ideas and an application coming up to really use this translation better. So I don't give you much practical examples, I think, but it means everything, I think, this connection.
I think watch this space as well, hopefully, cross fingers. Claire, I was hoping you might ask a question.
Yes. Hi, Matt. That was a really useful and helpful presentation you did. My son had ME/CFS age 13, and he recovered using mind-body techniques. As a carer, what's the influence of carers on the effect on symptoms of people who've actually got these conditions? Is there any research on the effect of carers on the people who've got the condition?
I'm not sure about that, so I don't think I should answer the question. We use techniques that we borrowed from Ted Kaptchuk at Harvard and other colleagues that we work with to see if the caregiver, like in these situations where you have irritable bowel syndrome, etc., could influence symptoms. But in this, when you're the caregiver, like where you have an afflicted family member, for example, there is much research that I'm not sure of that I wouldn't summarize, I think. So, but it's a really good question, I think, very important. Sorry.
It is very hard to find a lot of any research on this.
Is it?
I haven't found much.
No, I have also, my younger colleagues are much into these social psychoneuroimmunology perspectives, and that's a lot about changing the behavior of the caregiver, or trying to understand how this sickness response actually impacts how you perceive people and how the sick person is perceived. So that is relevant, I think, for the perspective that you bring. But I am not sure about good research to help to improve the caretaker behavior.
Okay, thank you. Certainly, there's emotional co-regulation that we know.
Exactly, true. But, definitely. Yeah, there is, of course, research, but I'm not an expert, I think.
Yeah, and I imagine
Okay, thank you.
about stress and stressful external events that that will fit in with caregiver. Molly,
Hi,
hello, I've got you.
yes, I've recovered from long COVID and chronic pain and happy to be here. I had one research suggestion and one question. One of the things that was helpful to me when I was recovering from long COVID was finding an article that showed that clots, like microclotting in the blood, can be caused by the sympathetic nervous system. And there's some historical studies on the physiology of that. And that makes sense, right? Like in fight or flight, we would likely see blood clotting. But when I had long COVID, I read a lot about how everyone with long COVID has microclots, and that's a big problem. So that may be of interest for the research. And the question I have, which is more generally related to the immune system and sickness, I have 2 young toddlers at home now. There's a lot of cold viruses and flu viruses in our house all the time. And what's interesting to me now is my husband and I do not always get sick. And I think it's related to whether I'm stressed or whether, to your earlier point, like my body is saying, you need to take a break right now. And there's so much around people saying, well, maybe you've already had that cold virus, you already had that flu virus. That's why you didn't get sick and your husband got sick. But I'm curious, Mats or anyone else, how you might think about that just when you're in an environment, and I'm sure teachers and doctors are around this too, where you are constantly exposed to different viruses.
Yeah, I'll try to answer really short about this more psychoneuroimmunological perspective, where we know that, of course, physical fitness and sleep, to some extent at least, and etc., could be important for resilience. But I actually think this is a question to be answered by Paul, maybe, rather than myself. What do you say, Paul?
On the microclots, this was actually on the microclots.
Well, and who's getting an infection and not when you're surrounded by infected people?
There's not an easy answer, really. Infections wane and come. There are so many viruses circulating at any one time. I feel that there is an interaction between stress and infection as well. And I'm going to stop there.
I experience it too, but it's anecdotal. Paul, I thought you'd talk about the microclots. No?
I mean, I think the microclots have largely it's an invented term by a group of people. We've appraised the research, and there's really no substantive evidence behind it. And very happy to. One of the things it has done is make people frightened. It provided a sort of rational explanation, but there really isn't much evidence behind it. The studies were not particularly well done, but the theory persists. I think the other explanations for it that are for our conditions is what we're hearing about today, and I'm very grateful to Mats for bringing this narrative in.
Thank you, Paul.
Rachel, can I add one thing on that would be maybe a better answer to Molly's question about sensitivity from the stress perspective? And that's quite well, I would say, research that little longer stress exposure that you really can't control, etc., it increases susceptibility a little bit. It's not that much, but there is an effect that you can measure. Much of that is done for in people where you don't manipulate how stressed you are. They only measure how much stress you experience for a month or so, and then there is an increased risk to catch a virus when you're exposed, like inhaling cold viruses. So it's not perfect research, but most of the studies show this relation between not recent, but months of stress exposure and slightly more susceptibility to develop a cold when exposed to the virus. And it's some studies also indicating that for sleep, when you sleep too little or have too poor quality, but it needs to go on like for a longer time for the effect to be shown. But there seems to be one of the many things that will actually determine if you really get a cold or not.
Thank you very much. I'm laughing because Rebecca said to me at the beginning, is it a hard cutoff at 7? And I was like, yes, absolutely. I didn't quite anticipate then the amount of questions. But then I figure it's okay because people can leave if they want. It's not like we're in a room. Mabel, at least you haven't had to be like that for ages because of these virtual hands. It's much better, isn't it?
Yeah, thank you very much. Well, my name is Mabel. I'm from the Netherlands. I recovered totally from long COVID. And I was triggered by what you said, Mats, about when you got the vaccination. You said something like, I got excited, to see what's going to happen. And I think that's very interesting because I think that's the opposite what happened to all the people with long COVID. And I totally related to what Rebecca and Amy said. I got COVID and I got tremendous, horrific symptoms. I really thought I was dement. I couldn't remember things. And I also got this blue toe, by the way. But so I think it's interesting. It's just when you get a flu and you get a headache, you just know it's going to leave. You will be better, and that's the difference. I think with COVID, there was so much fear, and it was very unconscious with me because I was totally not worried about COVID. I was really relaxed about it. But when I got all these weird symptoms, it went spiraled down. And then also what Rebecca said and Amy, when you get all these messages from doctors, like you have to be, how do you say, you have to take rest and to not to do too much and all these things, it's just added up in spiraling down. And then I really needed someone like Rebecca, thank you, Rebecca, to tell me that the brain fog was not damage in my head. Because nobody could tell me. Nobody said, no doctors, they all said, well, we don't know if you can recover. And that's all the fear. And I just want to say to all the doctors in this room, it's so important. And probably you all know, but maybe I should tell all the doctors who are not in this room that it's so important what you tell the patients, because you lose hope. I thought I was, it was the end. And then, of course, I was so happy to find the mind-body world and Rebecca, and I'm totally fine.
Thank you so much. And not just totally fine, Mabel, but then
Yes.
often helping other people in your language as well. So thank you so much for sharing.
Yes, and sorry, I had a question and I forgot about it. And it was like, is there any research, Mats? Maybe it's totally different area, but do you have any research, how do you say, ideas about maybe the role of emotions with long COVID and all the other ongoing symptoms?
Well, indirectly we do, but we don't do much studies ourselves. But of course, the anxiety response we do study, and we studied the depressed mood response, like having more depressed symptoms. And there is actually quite a bit of things going on in that direction. Of course, emotional regulation, which is like a general term for different kind of emotions to either upregulate or downregulate them. That is one huge topic, both in research and in the clinic, in modern therapy. So that's really important. And it's also part of this psychoneuroimmunology world where we try to actually see what that can do with the sickness response. So quite a bit about that. Next week, I am going to southern Sweden to be the faculty opponent on a dissertation which is about inflammatory depression. So it's a subgroup of people with major depression that have increased inflammatory signaling, and it's maybe part of the pathophysiology. It's definitely part of the suffering, but it's maybe actually like a cause in a subgroup, only a subgroup. So there they try to look on some supplements actually that could work for the subgroup that has signs of increased inflammation, and other like trying to applicate a precision medicine or personalized medicine approach to this very broad concept of depression. And there they measure a lot of these emotional outcomes to try to, if we can also from the symptoms see who is more likely to have an inflammatory depression, and why that is also connected to being resistant to treatment. So there is a huge movement actually going on in this direction, more related to psychiatry in general, actually.
I was wondering if I could just say one thing.
That's
First of all, it's so great to see you, Mabel. And I'm using your postcard as a bookmark in Howard Schubner's new book, Unlearn Your Pain. And just was so happy to see you're developing a Dutch course. And it's beautiful when people are spreading this. And I'm also grateful to all the clinicians here learning about this, right? Because I agree with you. It's so important what we're told as patients. It really impacts that threat response, right? And our expectation and interpretation.
Yeah, and thank you so much, everybody. I think the two things that are really powerful for me tonight, one is the fact that we're talking about how the mind and the body interact with each other, and we're not talking about either or. So I think that's really key. I think the other thing that's just really good is Mats, I noticed, if you don't know the answer, you're saying, and we realize that there's a lot that we don't know mechanistically. And I think that's really key. I go onto a lot of patient groups where people say, but this theory sounds good, so it must be true. And realizing that we don't necessarily know everything, and yet we are seeing hundreds of people recover.
When it sounds,
so that's also powerful.
yeah, when it sounds really good and fascinating, then you often cannot replicate the findings. So it's a big warning signal if it sounds too good to be true. It's often actually too good to be true.
Yeah. That said, it sounds too good to be true that Amy and Rebecca recovered and Mabel recovered, and I've just noticed Jackie
Definitely
Baxter's on this
so.
call, and I've recovered, and Claire, and I've noticed Jane, who I know you came onto the last Coffi video talking about 32 years of recovery, and we've got Jan Rothney who recovered, and Torre whose children recovered. So I think we can be certain that recovery. And Paul as well. In fact, most people on this call. And so I think we can be certain that recovery is possible. Thank you very much. It has been an honour. Hello, Will. I've just seen Will, by the way. And we will put this recording onto our YouTube channel over the next week. Thank you very much to Joel, who has organised all of this as well. He's not just admin, but also a researcher in his own right. Thank you very much.